Hi, my name is Rachel Hebert, and I'm an occupational therapy student. And today I'm going to be talking to you about what is occupational therapy. Occupational therapy is the only profession that helps people across the lifespan to do the things that they want and need to do through the therapeutic use of daily activities. This enables people of all ages to live life to its fullest by helping them promote a healthy and preventable life through their injuries, illness, or disabilities. This is straight from our occupational therapy practice framework. This is their definition of what occupational therapy is. Now, if I had to use an elevator speech, I only have 30 seconds to tell you what occupational therapy is. I'm going to say an occupational therapist addresses the things you do every day, the things you need to do, and the things you want to do. Furthermore, it is a profession that uses assessments, interventions to develop, recover, or maintain meaningful occupations for individuals, groups, and communities. Occupational therapists use a holistic approach. So, a holistic approach is an individual, client centered approach that addresses the mind, the body, and the spirit as a whole. So, this is a 3-in-1 approach to address all these things. So, this is done through theories, through medical policies, and through creativity to address your occupations. Here are our domains. So these are things that are addressed in your everyday life. So your environment, it's who's around you, your supports, your relationships, your personal, that is like your age, your gender, race, your education. Then we have your habits, roles, routines, and rituals. So these are things you do every day. It's your morning routine. It's how you brush your teeth or brush your hair or get dressed or anything like that. Then you have your values, beliefs, spirituality, your body functions, and body structures. This is what makes you you. So, this is how you work your body, move your body. This is what you believe in. And then finally, you have your performance skills, which are your motor skills. So, how you're moving, your processing skills, how your brain is working, and your social interactions, which is your relationships. And there's a quote here on the end that I think really sums up how beneficial occupational therapy is. It says, medicine adds days to life, but occupational therapy adds life to days. So I'm sure you're probably wondering, what are occupations? No, it is not your job. Occupations are specific and daily, broad and specific daily life events that are personalized and meaningful to the client. So this is your ADLs, IADLs, social, education, work, leisure, health management, play, and sleep. For the most part, you know what these are. You know what playing is, you know what work is, and education and sleeping. But some of the things that might be more difficult to understand are ADLs. So, ADLs are activities of daily living. So, these are the things that you have to do every single day to survive. So, going to the bathroom, being able to brush your hair or brush your teeth, getting dressed, eating your meals, bathing, moving around. So these are things that often can be addressed in your morning routine, which is why a lot of the times occupational therapists work with you early in the morning so we can make sure that you're able to be presentable, look nice, smell good, and be dressed so that you can go and do the other activities like your leisure or work or school or social. So you need to start with these first. Then the next step from here is instrumental activities of daily living. So these are things kind of that you do around the house. So your laundry or cooking, grocery shopping, taking care of a child or a pet, all are supplemental to your ADLs that you do every day. The population that we can work with is anyone. It's from life to death. So you can work with pediatrics, older adults, you can work with school age children, people with a neurological deficit, mental health issues, anything of that sort. You can work with anyone of any age. Now, here are some practice settings. So, acute care, so like the hospital, inpatient rehab is a very large setting that occupational therapists work in, and this is where patients are required to have a minimum of 3 hours of therapy a day amongst occupational therapists, physical therapists, and speech pathologists. Then we have subacute care and long term care, which is where you would go before you are able to be discharged home. Then there's outpatient, so when you're coming to a clinic for an hour a few times a week. Home health is when occupational therapists come to your home. And then a community setting, which is what the American Stroke Foundation is. So, how does this relate to you? The American Stroke Foundation is run by occupational therapists, occupational therapy students, and occupational therapy assistants. So, we provide interventions to address your daily occupations. We also provide you with information for you to improve your performance skills on a day to day basis. We provide information for your caregivers and additional education on any sort of injury or anything that you guys need or want. And every day, what we're doing at the American Stroke Foundation is meant to be carried over to your home life. Because at home is where you spend the most of your time. And this is where you spend time with your family and friends and your loved ones. So we want you to be able to be performing at your best of your ability. So the things that we do here, like the morning muscle moves and all of the different like creative conversations, that is all to improve your ability to perform your occupations to the best of your ability.